I'm Dr. Dan from Vitamin Pro, and this is part 2 of a two-part series talking about supplementation that will help people who are gluten intolerant to regain their health and to maintain their health. Now, part 1 talked about things like antioxidants, essential fatty acids, and part 2 we're going to talk about vitamin D, magnesium, probiotics, and bone support, things like calcium and strontium. Now, the cell membrane, as we talked last time, consists of those two fat layers, one outer and one inner, and a protein layer between. Now, each membrane has these little specialized formations called receptors, and these receptors control what goes into a cell and what comes out. And this is what I call cell security. The most common receptor on the cells in the human body are receptors for vitamin D. So this implies that vitamin D is vitally important for controlling cell activity and is absolutely key to proper cell security. Low vitamin D levels have been linked to most chronic problems, and that includes problems associated with gluten sensitivity as well. As with CoQ10, the recommended dosage for cell repair and maintenance keeps going up with time. Now back in the old days, they might recommend 500 IUs a day, and right now we're recommending 5,000 IUs per day as a starting point. So if you're suffering from something like fibromyalgia, your healthcare professional may suggest something like 50,000 IUs once a week and then 5,000 IUs the other days. So what about toxicity? Now that question pops up a lot because people sometimes don't know that they need to supplement their vitamin D to be healthy, but then they've heard that they can get too much. So, for example, if you're in the sun for about 20 minutes or 30 minutes on the beach in San Diego in June, you might get 20,000 IUs of vitamin D at that point. So your body really can process a lot. So if you're gluten sensitive, and you should be adding vitamin D to your daily regimen. Good choices here are NutriWest Vitamin D 400 and Metagenics D3 5000. And some people prefer the Metagenics ISO D3 as well. Now the next topic is magnesium. Now gluten can interfere with the proper uptake and utilization of magnesium. Now magnesium is involved in about 325 chemical reactions in the cell every moment. Magnesium is also essential for neurotransmitter production and regulation. The RDA of 350 milligrams per day is probably okay for a totally healthy person, but for gluten sensitive it's probably not going to be enough. Now a good blood test tends to show something about the adequacy of your magnesium intake. It won't tell us everything, but it gives us an idea. Now, which is opposed to a calcium blood test, which doesn't really show that. That's something different. You can't tell dietary calcium by a blood test. If you look at what's associated with low magnesium, it looks suspiciously similar to the list of problems associated with gluten sensitivity. Some of the problems associated with gluten sensitivity or gluten intolerance may be in part due to interference with magnesium uptake and utilization by the gluten inflammation process. Our favorite right now for supplementation is MGK-zyme from Apex Energetics. So we have learned that we can't make it here on our own. In many ways, our body is really a multi-species community. We need help from friendly bacteria in our skin and also in our intestines. If you are gluten intolerant, you may have less than an ideal environment in your intestines, and that will interfere with your ability to heal. Now, one strategy that some people use is to put every kind of bacteria that your body might want and put it into a capsule. Now, research shows that isn't the best plan. That's just what we call a party in a pill, and you're not going to get productive healing that way. So there's a better way to go about it, and we can talk about that in another video, but we do recommend some Metagenics products for this particularly, and some people do really well with the Biodoff from Biotics too. But one thing it's that the cheaper companies, the companies that kind of don't use as much quality control, is that they won't monitor genetic drift, because as time goes on, these bacteria will actually change, and a good company will keep monitoring that, make sure that you're getting the right bacteria for you. So Again, stick with a reputable company. We've been using Metagenic Symbiotics for years, and Metagenic has really done a lot of work on their probiotics. And one of the popular ones, Lactoflamex and Pro-Bilardi. And of course I mentioned the Biotics Biodoff 7, which has been an excellent product too. Now if you're dealing with osteoporosis as an effect of the gluten problem, a good way to help your bones is strontium. Strontium has been shown to be beneficial for osteoporotic women since 1957, which was the first study that came out on this at the Mayo Clinic. But this is a short-term solution, because obviously if gluten is a problem, you should heal up. But for the short term, taking a little bit of strontium can be helpful. And it's a good alternative in many cases to some of those damaging pharmaceuticals that you'll see advertised everywhere. Now, much has been written in the popular press about calcium, so we won't go into great detail here. Most people need some calcium support, and there are different types that will help with the bones, different hydroxyapatite crystalline structures and that sort of thing. But we do have a few of these calciums that we can recommend. Give us a call if you need to know more about that. But anyway, so there's some basics on gluten sensitivity or gluten intolerance, and some supplementation that can really be helpful. So hopefully that will help keep you on the path to healing.